But what you saying, Jenny? Me saying a hot minute, you know. We're going on today, John. It's been a hot minute for real. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out there for a little bit, but still, I just have some fun, though. Well, my side can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better than worse.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Good day, Virgin Islanders, at home and abroad, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of January 10, 2022. Joining me this afternoon for information for the latest on COVID-19 data, where residents can get a free test, vaccine, and booster shot this week, is Commissioner Health Encarnacion. But before we go to Commissioner Encarnacion, I want to take this time to extend my deepest and most sincere condolences to the family of the little Logan Cruz, who sadly passed away this past Friday after a hard-fought battle against leukemia. I can't imagine there are words that can console a parent grieving the loss of a child. This community has been extremely touched and aggrieved in the passing of little Logan. And everybody feels a little helpless in these moments about what they can do. But what we can do is we can pray for God's peace for his family and the friends and everybody. And we can also remember that there are many more right here in our community and throughout the world that are currently fighting cancer. They're still in that fight and they have a chance. Let's continue to support that fight and that chance by going out and contributing where we can, advocating for rights, getting our loved ones to get tested, whether for prostate or other, continue to have breast exams. Let's do all we can to make sure that cancer is a loser in this fight. Logan's fight and his light through it all will remain an inspiration and a symbol of strength and perseverance to us all. My heart and my prayers, and those of my family, go out to his parents and his entire family circle during this very, very difficult time. As you know, we are now entering the third week of this Omicron surge. We announced changes to our protocols that include time restrictions at bars, which we know now is last call is 11, and every place has to be closed by 12. So that's for nightclubs and restaurants as well. we implemented a 72-hour testing requirement for all travelers into the territory, whether vaccinated or not. And I know my apologies to some of you who reached out to me on Facebook Messenger. All of your messages didn't get through. I was looking into the side where it's for people who are not friends. And there were a number of you trying to get back to the island. I just saw those this morning. But for those of you who got into my messenger, I hope you made it back safely. This 72-hour operation that we implemented, I know it was very strenuous for a lot of people, and our apologies. But we're just trying to keep the majority of people safe. So it's still 72 hours to get into the territory, whether you're vaccinated or not in the territory. And I know some of you also are inconvenienced by the scale back of our government office hours. But we just want to ensure the safety of our employees by reducing interactions with the public. Just like everybody else in the territory, we're facing some of the kind of staffing challenges as well, as more and more of our personnel are infected with COVID. And rather than shut down totally, we're staggering hours and being able to keep people in. Those who are well can come in, because even if they're not getting it in government offices, they're getting it elsewhere. So those changes were set to expire today, Monday, January 10th. And last week we said we would monitor and look at all of the things that are going on, the decisions and the protocols, and we would decide then. I mean, we know we're hoping this surge subsides quickly, but if what we're seeing globally and nationally is any indication, I think we still have at least another week or so of this, riding this out, and then hopefully it'll expire sometime around the next 2 weeks in terms of starting to go down. So what you need to know is that we have extended all the protocols that we put in on the 10th for 2 more weeks until January 25th. Those are very minimal restrictions, just to let you know. We also were expecting to see schools open up physically today. We decided not to have that, to actually have students return to school, but virtually until the 24th for instruction, where we'll try to do it physically. That also we'll be watching within the next 2 weeks. But I just want to take this opportunity to welcome back our students, teachers, faculty, and everybody else, and all the other school-based personnel. I know you're returning to school under less than the ideal circumstances, but we're just following what the expert scene says and looking at all the data to make sure that we keep you, the students, everybody else safe during this global pandemic. To our students, it's been a rough year and a half, almost 2 years now, dealing with this pandemic. But you're hanging in there. I mean, I often think about all those kids who graduated last year and the year before that didn't get to get their senior year. I knew how excited I was about it. But, I think that we're finally seeing the end of the tunnel on this COVID thing. So I thank you for your patience and your diligence, and encourage you to hang in there and get vaccinated, of course. And to our teachers and our school-based personnel, I just want to thank you as well for continuing to support our students. Both the Lieutenant Governor and I often think about our teachers and our administrative staff, and we are very grateful, the Brian Roach administration, as well as the entire Virgin Islands community, for your support. And, don't worry. I've been getting a lot of calls from the AFT union. We got your contract. We're going to get that signed up and going to get you guys paid, all right? So just have a little patience with us. There's 2 million things going on at one time in the Virgin Islands. So this week we were expecting to be doing the State of the Territory tonight. That too has been postponed until the 24th. We're getting together all of the requirements and the stuff that we need to get that done safely in the Senate chambers. So I will go to Commissioner Encarnacion and let her tell you about what's going on with COVID and where we're at in the territory. Commissioner?
Thank you, Governor. Before I start with the COVID numbers, it's important to note that we're working hand in hand with the Department of Education to ensure that we test everyone before they begin, and of course we'll be doing recurrent testing as the time goes in. So we're supporting them hand in hand. Like you said, Governor, we need to get the children back in school. Good afternoon, Virgin Islanders. Our COVID-19 report shows that as of January 7th, we have conducted a total of 269,863 tests. Of those tests, we have validated 12,541 positive results. Our 7-day positivity rate is 24.30%. There are currently 3,782 active cases in the territory, 1,821 active cases on St. Croix, 1,708 active cases on St. Thomas, and 253 on St. John. 8,090 cases have recovered, and fatalities remain at 89. There are currently 6 individuals hospitalized on St. Croix with no vents. On St. Thomas, there are 12 individuals hospitalized and 2 vents. And so right now, we have a total of 18 hospitalizations, 2 vents. There's one on a BiPAP in St. Thomas, which is considered a vent for our counting purposes, so that would give us 3, but 2 on the actual ventilators. SARS-CoV-2, the virus that causes the disease COVID-19, has many different symptoms, and as the variants develop, the symptoms may vary. But for the most part, the cold and flu-like symptoms, headache, cough, fever, a sore throat, aches and pains, and some gastrointestinal upsets have been consistent. Let me not forget the very uncomfortable inability to taste or smell. If that sounds like you or anyone you know, please stay home and advise them in turn to do the same thing. Further, if you have any of those symptoms or have been exposed to someone with COVID-19, you should call the epidemiology hotline to schedule an appointment for COVID-19 testing. The hotline is open 7 days a week from 8 a.m. to 10 p.m., and that number is 340-712-6299 or 340-776-1519. An appointment should be made also to schedule online with COVID-19 USVI.com/testing. The COVID-19 website also has a listing of other providers throughout the territory that offer COVID-19 testing. Individuals who test positive for COVID-19, whether exhibiting symptoms or not exhibiting symptoms, are to isolate for 10 days. Individuals who test positive for COVID-19 should not leave isolation to retest. Anyone waiting for results from the Department of Health's drive-through testing site should remain at home and not return to the testing site for any reason. Remember, you expose others as you come out. Individuals who have been identified as close contacts of someone who tested positive for COVID-19 should not go to work, events, grocery store, or anywhere in public, including airplanes. If someone is sick or have been identified as a close contact of someone diagnosed with COVID-19, they should remain in quarantine for at least 5 days while they wait for the test results. If they test positive for COVID-19, they are to isolate as instructed by the Department of Health. A fully vaccinated individual is exposed to someone confirmed to have COVID-19, they may return to work after quarantining for 5 days and get tested if symptoms develop. If symptoms do not develop, they should return to their normal activities and continue to wear a mask over their nose and under their mouths. If an individual who is not fully vaccinated has been exposed to someone confirmed to have COVID-19, they are instructed to quarantine for 10 days and test on day 7 of exposure. I'll have Janessa, our PIO, put this up also because I know that sometimes it's a little confusing and there are some concerns and questions. That's why we repeat it, but it'll be on the website and also will be on our Facebook page if you have any questions. Drive-through testing on St. Croix at the Charles Howard Complex and in St. Thomas at the Schneider Region Medical Center will continue with pre-scheduled testing appointments, which is required, from 9:30 a.m. to 12 p.m. And pop-up testing, no appointments required, from 1:30 to 3:30 p.m. Monday to Friday. On St. John, pop-up testing is on Tuesdays, Wednesdays, and Fridays from 12 to 3 p.m. at the VI Port Authority gravel lot. Pre-registration is strongly encouraged and reduces your wait time, even for the pop-up testing, and allows us to serve more of our community members. You can visit www.covid19.usvi.care/testing for more information and to sign up. Here are the pop-up testing sites and times. St. Croix, Monday to Friday, from 1:30 p.m. to 3:30 p.m. at the Charles Howard Building. St. Thomas, Monday to Friday, from 1:30 p.m. to 3:30 p.m. at the SRMC drive-through location. St. John, Tuesday, Wednesday, and Friday, from 12 to 3 p.m. VIPA gravel lot, as said before. Some more reminders. If you find out that you have been exposed to someone who is positive for COVID-19, do not run out to get a test right away. You may not develop symptoms or test positive with symptoms until 2 to 5 days following your initial exposure. Follow guidance as spoken before. Are you a close contact? If the answer is yes, stay home and wait 2 to 5 days to get tested unless you develop symptoms earlier. Only then should you get tested prior to that 2 to 5 days. To get tested unless you develop symptoms, like I said, this is critical for several reasons. It may help you to reduce your level of anxiety, protect our very essential and special Department of Health manpower, and help us to prevent from exhausting our tests and supplies. Plus, it saves you time from coming back to be tested if you're tested the first time negative and then develop symptoms. It is important to know that contact tracing will not occur in all positive cases. If you test positive, the Department of Health EPI team will only contact you for tracing if you are or were hospitalized or considered extremely high risk. To request a return to work, and a lot of people are asking for these letters, please submit a request to results@doh.vi.gov. I'll repeat that, results@doh.vi.gov. Things to do at home if you test positive and are not in need of emergency management. Remember, the first thing is that if you've been exposed or if you feel sick in any way right now, stay home, get tested within the appropriate period of time. If you are not requiring oxygen, if you're not having shortness of breath, or for some reason feel as though you're getting to the stage where it's imminent that you go to emergency room, please don't go to emergency room. If you're sick, of course, go to the emergency room. It's important. But if it's just to get a test, it holds up a seat that someone else that might really mean or need to be in the emergency room. So we're asking you not to go there right away. Take over-the-counter medications for cold and flu-like symptoms to include Tylenol, Motrin, and cough suppressants. Note though, please do not go to the pharmacy. Call a friend or a family to do so for you. Prevent dehydration by eating and drinking even if you don't have an appetite. Island home remedies, honey, lime, ginger, and bush tea. Call your doctor for possibilities of inhalers or antiviral to help you combat your symptoms. Over-the-counter vitamins to include zinc and vitamin C and D are also recommended. I am encouraging you as a community to use your best judgment. We all need that right now. Limit your exposure. Wear your mask properly and gently remind others to do so. Do not run out for testing unless you develop symptoms. Clean the environment that's around you. Wash your hands, hand sanitize. If you are positive, stay at home, even if a contact tracer does not call you. Remember, we're only calling those that are immunocompromised, that for some reason have been hospitalized and need that special care. We are relying on you to do the right thing to limit the spread. We could not support you without the support of our clinical labs and public and private healthcare providers. Thank you, and be safe, everyone. Thanks, Governor.
Thank you, Commissioner. You know, the biggest thing I heard from you when you said that is like, if you're sick, do not go to the pharmacy. Call somebody to help you to get assistance there. Please, we just need to control the spread as much as possible. When you traverse the territory, as I do on the weekends and stuff. Sometimes it's hard to believe that we're in the midst of a global pandemic. But like I've mentioned before, this surge is real here in the Virgin Islands. And, you know, we had a discussion this weekend about Omicron versus Delta, and people telling me they're not as safe because they feel that Omicron isn't as deadly as the Delta. But you never know what you're going to get. You might be the unlucky one to get the Delta. So, and the Omicron is very much affecting people with a compromised immune system. So don't feel safe out there at all because you think it's just a little cough or a little flu. You never know how it's going to affect you. But as I said, we continue to look for the extension of the state of emergency that helps us to secure all of the different things that we have in place to keep you safe. It actually expires today. Remember, we naturally have the state of emergency extended every 30 days if the legislature doesn't vote on it immediately. We often ask for 90 days because it's cumbersome to go to the legislature every 30 days. But the Senate President and I had the discussion and we sent it up. It lapsed into existence. So by law, if the Senate doesn't act within 5 days of where we sent it, it extends it for 30 days. So our state of the emergency is extended until February 9th. Going to February 9th, we will be once again putting together something to get the legislature to extend it for 90 days, as we're going to be in this pattern for a while. And for people who question this, remember, we can't have the travel portal, we can't do mandatory testing in some instances. Some of the mandates that we have in terms of how many people can go in a room, how many people could be in a mass gathering, all of those things go away without the emergency measures in place. There are a bunch of other stuff that this emergency measure helps us to support, so we thank the legislature for their continuous cooperation and their endeavors to make sure that we have as much resources as possible to fight this global pandemic. In non-COVID related news 4 months ago, the Virgin Islands Water and Power Authority's Governing Board embarked on an extensive interview to find the next Chief Executive Officer of WAPA. This is one of the mandates that I really push with the board. You know, I get a lot of flack from the vetoing measures by the legislature to install control boards and whatnot, giving the PSC extra powers. You know, in government, you know, you don't, I have to go to the old adage, a rose is but a rose by any other name. You can't call it something else or switch it from autonomous to semi-autonomous and expect to get results. We have a board that governs WAPA, and we have a Public Service Commission that regulates WAPA. We also have a Senate that agrees or disagrees to put anybody that I want or send down, the governor, to the board. We have enough controls in place already. These things just have to work, and we have to allow people to do their work. Well, the entire executive team from WAPA essentially resigned or retired over the last year. And now today, WAPA's governing board has announced that an employment agreement has been reached between them and Andrew Smith to become the next CEO of the Virgin Islands Water and Power. With the announcement of that, I think WAPA takes another step towards making this historic shift towards a renewable company. Affordability and reliability of the service there is a priority to me. In the coming months, you're going to see initiatives that are come forth in order to help you, the consumer, be able to manage the cost of power. Whether we like it or not, the price of oil and fuel and gas is going up. That's not a WAPA issue. That's not a territory issue. That's a global issue. The Biden administration has been making reserves more available in hopes of flattening out the price of oil. But propane especially has taken a significant uptick. So we're doing the things, and luckily we have the resources to offset some of these impacts upon the people of the Virgin Islands, because we know people hurting, and they're going through it right now. So we're working with WAPA and of our friends in the legislature to help to control that as we move forward. Next Monday, January 17th, is Martin Luther King. Before I go there, let me just say welcome, Mr. Smith, to WAPA. That's no easy task at any salary. So I want you to give him your support and your prayers for the employees there. And for the community, this is a government company. It's part of us. So we're going to need all the resources to get it to work right. So looking for your support, constant support in moving WAPA to a place where we can control. We're almost there, not quite. We got some work to do, but we have the resources to get it done. It's just time. Next Monday, as I said, is January 17th, Martin Luther King Jr. Day. The Virgin Islands was the first in the nation to recognize Dr. King's birthday as a legal holiday, and have always celebrated his life and legacy with a march and a public ceremony. And I often think of Dr. King's legacy, and I am reminded of his fight for social justice and lifting people out of poverty being just as vigorous as his fight for racial equality here at home. We continue as an administration through those beliefs to move the dial forward in lifting the Virgin Islands family, the average family, out of poverty. Over 30% of our families suffer under the poverty line, and I think that's a conservative amount. But we are dedicated to doing so by ensuring free college tuition at UVI, because education is a way to really be able to get a gift that you keep forever that helps you get it in the world. By fighting hard to level the playing field and putting Virgin Islanders on the same plane as Americans living in the mainland when it comes to eligibility and access for critical federal support programs like food stamps, the stimulus, the PBT, welfare, home ownership opportunities, and also by paying hardworking Virgin Islands families their much deserved and what we owe to them, their tax refunds. People point out all the time, oh, it's their money. It is their money. But before, administrations never paid it, and we made a commitment to make sure that we come current on tax return, and we're going to do so. And we also do it by making home ownership more and more affordable for Virgin Islanders. We want to make sure that Virgin Islanders not only pay rent, but own assets, because assets is what really creates real wealth. And so while this year we won't be able to celebrate en masse as we do and have become accustomed to, I'm asking each of you to honor Dr. King in honor of the National Day of Service, which also celebrates his legacy, to take the time. Monday, you want you to really take the time to honor him with some small act of kindness, whether that be donating to a charity or safely getting out into the community and lending a hand to one of our many nonprofits who are doing excellent work helping those in need. I also want to say that in doing this, we have a real debt to the people that came before us. The things that we take for granted now, like going to school, people of color specifically, women working in the workplace with equality, women being able to vote, people of color being able to vote. A lot of these things were championed by people that we now take for granted, and their rights actually that we do take for granted. And we have to recognize that all the work of those people to get us to where we are today in the Virgin Islands, self-governing, and mostly people of color, be able to have a president of African American descent, to be able to move in all kinds of circles and get the same rights to education and social benefits. That didn't come easy. We worked for that. And people came before us and worked for it. We need to do the right thing and make sure that we vote, that we represent ourselves in society, and we make sure that we do all we can to send people to school and take advantage of education. I'll take some questions now. I see we have Susan Ellis on the phone. Susan?
Yes, good afternoon, Governor. Good afternoon, Governor and Commissioner. How's everybody today?
Good, how are you?
Good, good. Thank you for taking my questions. Commissioner, I'm wondering, do you have numbers of the infected cases that have been vaccinated? Is it still that roughly 8% that you mentioned a couple of weeks ago?
Yeah, that hasn't changed. So it's around the 8% still. Thank you for asking.
And I know that you are working so hard to get people tested. What about vaccinations? Are those picking up any?
Thank you for saying that, because after I finished speaking today, I actually said, you know what? I didn't speak about vaccinations. And that's one of the first things I always think about. So yes, our lines are longer. So we are seeing more people that are now being vaccinated, which is a positive. We are also seeing individuals that are coming to get their booster shots, and parents asking for those 5 and over to become vaccinated. So we haven't stopped. Our campaign for vaccination is strong. It's going on. And we really ask you to become vaccinated. And if you have been vaccinated, please get your booster.
Great, and that leads up to the next question about getting children back into school. Is the health department have any plans on setting up testing sites for children or parents before they get back to school live? And how can you be sure that when they do go back to school that we're not just exposing a whole bunch of children to a whole bunch of COVID cases?
Well, with the way the Omicron is working, that there is going to be some exposure. I think we have to just put that on the table and say that's going to happen. However, we're working this week where our private schools are opening. So our epidemiology department, our CDD division, they're working hand in hand with the private schools to be able to test. We're giving them supplies. They are working with other private entities to test prior to going into school. We're also working with the Virginia Department of Education, developing a testing plan. That testing plan is something that's coming out of our epidemiology department, CDD, as well as Department of Education. So in other words, we have to make sure that we are where we're supposed to be and they're where they're supposed to be when the testing takes place. First point of contact we're looking at is the first responders, which of course is the dietary workers, the housekeepers, because we want to make sure, speaking with both the commissioner and assistant commissioner, the goal is to begin the no school, no child left behind in terms of dietary. And so we want to start that as soon as possible. So this week we're working on those individuals to get them tested and back to work.
Okay, great. Thank you very much.
Thank you, Susan. Ernice, VI Consortium. No questions today? Before I depart today, I want to say happy belated Founders Day to my illustrious fraternity, Kappa Alpha Psi Incorporated. We celebrated ours on January 5th. I'd also like to say happy Founders Day to Phi Beta Sigma. So if you know a Sigma, they're celebrating their Founders Day today, and happy birthday to Samuel Sanis, our Christian State Administrator. I woke up this morning and there was a heaviness about me, and I couldn't really figure out what it was. It was like, it was a quiet weekend, uneventful for the most part, but I just felt heavy, and I felt so in the beginning of the year. It was a strange feeling. And I had the pleasure of speaking to several of my friends this morning, people that are close to me. And one of them pointed out to me, they said, at the beginning of the year, we, especially in St. Croix, we really have an opportunity to go out and revel and have fun with our friends and our family and loved ones. We have Kusha Rican breakfast, children's parade, adult parade, the festival, all of this entertainment in the village. You're really able to shake off and get out all of your frustration from the year, especially if you like to play mass like me. And then you get a couple of long holidays where you just be able to rest from that, and then you come back at the beginning of the year refreshed. We didn't get that this year as a community. I didn't think that we got that as a nation, that we had done a whole year of work, and it wasn't an easy year, it was a hard year. We had a lot of wins, but it was a tough year. Dealing with a global pandemic and people still not back to where they're supposed to be. Yeah, we got a lot of money that come in, but money ain't everything. The spirit of the islands and everything is down. And I think the festivals like Carnival and Festival help us to kind of refresh and renew and look at the world differently. And I thought to myself, everybody really needs to give themselves a break. I didn't know you're tired. I'm tired. not only the pandemic, but all the things that it affected, and just dealing with the normal things we deal to in raising families, taking care of our parents who may not be doing well, taking care of loved ones, people are passing away, and because of the communication is broken in our community, not being able to contact people, not being able to share warmth and celebrate different occasions with the people we really care about because we don't have the ability of going to them because we have a surge, or whether that is and change travel plans that may have been made years in advance of that special cruise or where you wanted to go. There's a lot of pressure in our community, and it's not easy. It's not easy. I need you to recognize that you're under a lot of pressure, because I see it in your faces when I pass you by and when I say hello. Something just ain't right. Give yourself a break. It's a lot. It's a lot that we're dealing with. But we could get through this, just like we got through everything else. Just take it one day at a time and just do the next thing. The next thing. Don't think about what you got to do in June. There's too much between now and then. Think about what you have to do today and enjoy the day while you do so. You know, this thing is going to be over soon. We've learned to live with it through some trying times last year and the year before. But this too shall pass. And recognize that you might need a little bit of help, whether spiritually in your church or mentally by talking to someone close to you, or a little bit more specialized help. You divorce yourself from the stigma of what that means and realize that these are unprecedented times of stress. I want to see you next year around this time. So just take it easy. Give yourself a break. And, know that this government, this governor, our administration, and the 9,000 people that work for the Virgin Islands government are working to keep you safe, your friends and neighbor, every single day. And we got you, no matter what. Stay safe, stay sanitized. Love you.